Hello, I'm John Hemingway. Welcome back to Shropshire. Now, about a year ago, we made a video on E. coli, watery mouth in lambs, just looking at it in a little bit more detail, a disease that we all see and that we all know about, and thought maybe that would be useful to a few people. And lo and behold, that was the most popular video that we made last year, so I guess it was useful to a few people. So I thought this year, well, we'll do the other disease of baby lambs of that age, which causes joint ill. So give me a couple of minutes of your time, we'll go through it in some detail, and maybe there'll be something there that's useful to you. Joint ill or septic arthritis is a disease that affects very young lambs, normally 3 days to a week old. We get an infection into the lamb, localizes in the joints, causes inflammation, joint swelling, a lot of pain, very lame lamb. Lambs can also get joint ill in the spine, which is just a collection of joints if you think about it. Lambs with this will be hunched over as though they're in abdominal pain, but it's actually the back, and they can lose the strength in their legs. In baby lambs, the vast majority of the cases are caused by a bacteria called Strep discalactiae. So this bug comes from the ewe and it comes from the environment. We know that some ewes carry this bacteria at least some of the time on the skin, on the udder, even in the birth canal, and it's quite frequently isolated from the afterbirth as well. Unfortunately, when we talk about pen hygiene for these diseases, we know that Strep discalactiae will live for quite a long time on clean, dry straw. Strep discalactiae can get into the lamb through a number of different routes. Anything that breaks the skin, so these are your tail docking and your castration sites, your ear tagging site, a study that looked at those mild infections around ear tag sites, isolated Strep discalactiae quite frequently. Also, it could get in through the navel, and we think as well probably through the mouth orally, through the GI tract or the tonsils. As with watery mouth, I cannot say we're going to be able to prevent every case of this disease, and we do see farms that seem to have textbook hygiene around lambing, and yet they'll go on and have a real bad outbreak of joint ill. We don't always get to the bottom of why that has happened. However, we can minimise the risks. We should start with operator hygiene, our own hygiene. We are handling every part of these ewes when we're putting them in the pens or lambing them. We're then handling the tools that we're going to use to break the skin on those lambs. We're picking up those ear tags, we're holding those castration or tailing rings. The least we can do is wash our hands in between, make sure that we're clean when we're starting to do those procedures that are going to break the skin of the lamb. We should think then about our equipment cleanliness. We're talking about ear tags and we're talking about rings. How long has that box of rings been open? How many people's hands go in it per day? Would it slow you down to put the ring on the pliers and dip it in some disinfectant before you put on the lamb? No, it wouldn't. Would it slow you down to do the same thing with ear tags? Would it hurt to put some surgical spirit in a spray bottle, squirt some on the ear before you put the tag in? Can't do any harm, it's not going to slow you down, it's better hygiene. I don't think you'd want to have your own ear pierced unless you knew that all the equipment was very clean. We want to make sure that the navels are dipped as soon as possible after birth, and is it practical to dip them again an hour or two afterwards? Maybe it's not, but if it is, let's do that, dip them twice. When we're talking about joint ill or E. coli, watery mouth, we've got to be so good on our stomach tube cleanliness. We're putting these tubes directly down into the gut. If we push the wrong bugs down there, we are off to a bad start. It's a good idea to get a protocol put in place for the proper disinfection and sterilisation of stomach tubes when you're not using them. Then we can talk about pen cleanliness, and of course all the normal pen hygiene advice still applies here, but of course with this bug we know that it will survive on clean dry straw, which is highly annoying. However, we know that the afterbirth is a common carrier of this bacteria. Normally we're putting the ewes in those individual pens before they cleanse, so if we do see cleansing lying about in those individual pens, let's get that out as soon as possible. While we've said that straw will sustain this bacteria, interestingly it does not live well at all on wood shavings. Now they are obviously more expensive, but if you're a smallholder with small numbers or very high value lambs, you may consider consider using wood shavings instead of straw for your bedding. And of course, we've got to mention colostrum management, because this is the most important thing when it comes to the diseases of baby lambs. I'm not going to go into the details of it here because that's a whole talk on its own, but if we want to minimize the number of neonatal lamb diseases that we have, our colostrum management has got to be right. Now, a pretty standard protocol for treating these lambs has been to give them amoxicillin, which is Betamox or Trimox, for 5 days on the trot. And we know that's a good broad spectrum antibiotic and it gets into joints relatively well. A recent study found that on some farms there was quite a high level of resistance to that antibiotic in the bacteria causing joint ill. So there's a conversation there to be had with your vet if you're finding you're getting no response to treatment. Remember, when you're treating these lambs, to use anti-inflammatories. This is a painful condition. Give them some effective pain relief. Finally, if lambs have been lame with joint ill in the legs or in the back for more than a week, the prognosis for them, unfortunately, is very, very poor. This is a painful disease and we should be considering whether it's fair to keep those lambs on if treatment has been unsuccessful during that time. So that's about it for this short video on joint ill. I hope there was something there that perhaps will be useful to you. I'll be back very soon with another video and I do hope to see you there. Bye.